So moving forward, oh, we only had Thomas's name on this one. I'm sorry, Christy. Before I introduce the program heads, I want to do a question about nuclear medicine specifically. What is nuclear medicine? Is it a new wave rock band, functional imaging using radioactive tracers, study of electrons and neutrons in the solar system, or a new imaging modality? Now, Thomas and Christy, you can tell us if we're right.
Yep, they nailed it.
That's always a relief.
Yeah.
Anyone who puts new wave rock band, we wonder if you're maybe in the wrong spot. Okay, now did Thomas or Christy want to say anything before we jump into the video?
Go ahead with the video.
No, they're both shaking their heads at me. So, okay. We're going to watch a short video here that we made just before the pandemic about nuclear medicine at BCIT.
I don't think of it as a job. I don't have to dread going to work in the morning. It's a wonderful feeling to get up and love what you do. Quality control is of utmost importance with nuclear medicine. So tracers that we prepare for our patients will make or break their diagnoses, and the highest quality is necessary to get the best images for these patients. What I love about nuclear medicine is how it blends both science and people skills. So I get to work in a lab and use really fancy high-tech equipment, but I also get to work with patients and make a difference, hopefully, in their lives. And it's a great balance to have a blend of both worlds.
All right, everyone take a look at this heart model here.
So the BCIT nuclear medicine program is the only nuclear medicine training program in British Columbia. Our students are taught through a combination of in-class learning, simulated lab activities, and hands-on clinical practice. The biggest advantage of students working in the clinical setting is that they are allowed to take the knowledge that they gained and apply it to real-life practice and develop competency in the skills that they need to do the profession.
The instructors at BCIT, they know exactly what's expected of a graduate technologist, so I feel that they know exactly how to prepare us to be working in the field when we graduate.
Usually by the end of the test, I can take the most fearful patient and make them feel like they've had a really good time with us here in nuclear medicine. Sometimes you can really get to know patients and you feel like you're really making a difference in their lives. That's really rewarding.
On to you, program heads.
Thanks, Erin. As Erin introduced us already, my name is Christy Owen and I share the program head role with Thomas. So a little bit about nuclear medicine and what makes us so special compared to the other imaging modalities. And that is that we are very functional based. So we use a tiny little bit of radioactivity tagged to a pharmaceutical that follows your normal body system. So in this example, you can see that we've labeled something that goes to bones. So if you think of something that the bones that might be attracted to bones, you might come up with calcium as an example. What we use is a radioactive phosphate. And so we can detect tiny, tiny little changes on a cellular level of metabolism in the bone, which is pretty cool. The machines that we use to detect these are, there's a few different types. The main one in nuclear medicine is a SPECT-CT, which is what we've just recently acquired in our new space in the Health Science Center. So we have a brand new SPECT-CT that we're really excited about. And you might have also heard of something called a PET scanner, and that is a branch of nuclear medicine that uses a slightly different kind of radionuclide, but same as nuclear medicine, is very functional based and uses a CT fusion as well. So some fun facts about nuclear medicine that we feel are special. So what is exciting for us is we are not a 24/7 department typically. So it's usually open typical business hours, sometimes a little bit into the evenings and sometimes weekends, but we usually are not on overnight or anything like that or on call. So that's kind of nice if you're looking for a job where you're trying to balance home and work life. We do two types of procedures. We do diagnostic procedures. So that means looking to see what's causing the person some symptoms, trying to figure out how we can contribute to the patient's overall health journey with their physician, and kind of answering questions that the physician might have. And sometimes patients come to us and the question's already answered, and then we're looking to see how we can help treat a patient. So they might be having pain from bony tumors, and we can help with that, or they might be having thyroid problems that are making their thyroid overactive, and we can help with that, or prostate cancer. There's so many new avenues that we're really making a huge difference in with cancer treatments, and or just overactive tissues, basically. The cool thing about being involved in nuclear medicine is you're sort of got a nice balance between using really cool technology, as Heather said in the video, but also you're doing direct patient care. So you do have that time and that interaction with patients just from the moment where you check them in and bring them into your camera room, to setting them up on the bed and making sure they're comfortable and sort of easing their nerves or whatever may be kind of impeding the study from continuing. So just helping them out and getting through that day and that test. So that's pretty cool, feeling like you can make a difference. Most of our departments are in the hospital. So you'll find that nuclear medicine departments in BC are in a hospital setting. There are a couple of private pet clinics, but typically we are in the hospital. So you get to kind of get your bearings on what else was on the hospital, meet other types of imaging modalities and the other hospital staff, and your interprofessional education is really good because of that. Also, for our job, we're pretty special because we don't just do the same thing all day. So typically in nuclear medicine department, there's such a huge variety of scans, and that's just due to the fact that we can take radioactivity and we can basically label it to any imaginary pharmaceutical that could go to a bunch of different organs. So we can image the brain, we can image the thyroid, we can image the lymph system, we can image the heart, the liver, the stomach, the kidneys, the bones, we could go on and on. So that's pretty cool. And lastly, something that's really fun about nuclear medicine is it's a hybrid imaging. So we do take images with our gamma camera, so using the radioactivity, but we also take CT images, which helps us localize small anatomical changes in metabolism in the body. So hybrid imaging is something that is pretty typical in these days in nuclear medicine. Go ahead, Thomas.
All right, thanks, Tracy. So one thing that makes our program special is our emphasis on relevant hands-on training to develop practical skills that are used in the profession. Now, this picture that you see on this slide here was actually taken in our old lab using our previous gamma camera. As Christy alluded to earlier, we're very excited because we just moved into the brand new BCIT Health Sciences Center, where we have a brand new state-of-the-art SPEC-CT gamma camera for students to use during their training. I'll get to advance the next slide. So now I'll just briefly talk about the framework of our program, what it looks like. So our program is a continuous 24-month program, and we have each year we accept 16 students into the program. Now, the first year, you spend most of your time with academic studies, learning through foundational courses and applying knowledge and theory through some hands-on labs. And then this is followed by your first summer, where you spend 12 weeks in clinical full-time. In second year, this is where we do something unique in our program, where we do alternating 2-week rotations. So you actually spend 2 weeks studying at BCIT, and then you rotate out 2 weeks out in clinical, and you kind of switch back and forth. So you get an opportunity to learn some theory and apply the skills out in real life world. You finish off the program in the second summer, spending another 14 weeks before you graduate from the program. And next slide. So I'll talk a little bit more about the clinical side of the training. So in the program, there's a total of 40 weeks of clinical, and they are full-time days. So you're spending 35 weeks or 35 hours per week. Now, clinical sites are located throughout the Lower Mainland and Vancouver Island. Each student will work at 4 different clinical sites throughout the 40-week of clinical. Now, in addition to just regular clinical rotations at nuclear medicine departments, students will also get an opportunity to spend time in specialized departments at BC Children's, at the pet clinic at BC Cancer, as well as dedicated CT departments. Now, I will pass it back over to Christy, and she's going to talk a little bit about job opportunities after graduation.
Thanks, Thomas. So typically when our students graduate, they are hired before they finish, because everyone is very desperate right now and they need all the help they can get. So job opportunities right now are really, really, really good, which is very exciting. So out of our graduating classes the last 2 years, basically everyone's been hired, which is really exciting, and getting close to full-time work. So what does that look like? Sometimes it doesn't look like a permanent position. Usually it starts out as a casual position. So that means that you can decide which hospital you're working at, well, if they hire you, and you can sort of say when you're available versus having someone set your schedule. But there is opportunity for full-time work, absolutely, once you graduate. And our students have been employed up north, Fort St. John. They've been employed over in the interior, as well as on Vancouver Island. So really like widespread employment as well. Yeah, so next slide, please. Just talk a little bit about some of the places you can go after becoming a nuclear medicine technologist, because there is a lot of opportunities to grow professionally. So one example could be Thomas and I, who started at BCIT after we graduated, and we were in teaching as instructors in the program, which we still are, in addition to our kind of more administrative roles. But some other ones could be a radiochemist. If you have background in chemistry, you could be involved in helping design some of the radiopharmaceuticals. Radiation safety officers are at each nuclear medicine site, and they monitor the safe use of radioactivity. Clinical application specialists are employed by vendors such as GE, Siemens, to help when there's a new installation and there's new software to help get that program going in each department and provide the adequate training for the technologists. Additionally, you could be involved with the vendors for selling those pieces of equipment. We just acquired a new spec CT, like we've mentioned, and it's a Siemens spec CT. So, you can imagine that there's lots of opportunities as this profession is growing for jobs to sell some of the equipment. Directors, so medical imaging directors, position in the hospital. So, in your department, you might be a technologist, there's a student supervisor, there's a department supervisor, and then within the hospital, there's imaging modality supervisors, there's directors, and it goes up from there. You might be interested in research as well. So those are just some ideas of where you might go within the nuclear medicine field after you graduate. And then what about outside of the nuclear medicine field? So let's talk a little bit about that. Oh, no, actually, let's not. Let's move to Abby. Sorry, I thought the next slide was the laddering. Pardon me. Go ahead, Abby.
Okay, hi, so I'm currently a second year in this program. And I'll kind of just go into kind of how I found the program, why I kind of joined it. So I had finished my undergrad in biology at UBC, and I graduated and was not sure what I wanted to do. I was kind of sure what I didn't want to do, but I was kind of looking around. I knew I wanted to work in the hospital setting, but I wasn't really interested in becoming a doctor or nursing. So I was looking around a little bit, and during my degree, I really enjoyed working in the lab, but I didn't want that to be my whole career. So when I found nuclear medicine and found that it kind of combined both working with people and then also being able to work in the lab as well, and kind of getting the mix of the two, I started kind of researching a little bit more. And I've always been really interested in physiology. So the fact that we image function was really interesting to me. So I joined the program, and while being in the program, I've just been so fascinated, honestly, by kind of learning everything. You learn a lot, but everything is really, really interesting. And I didn't even know this really existed before I joined the program. But a really good thing about the program is there's only 16 people. So you really become close with all of your other students, you make friends, you feel really supported in the program. I think that's the biggest thing that I found is not just supported by, your fellow students, but all the instructors you can really tell that they want you to succeed. They really support you in any way that they can. And then being in second year, as I've finished my first clinical rotation and being in the hospital, it was really cool to kind of apply everything you learn in the first year and kind of see it in person and be, oh, that's why we do that, or, kind of applying it in a way where it makes sense now. It's not just theory, you kind of get more hands-on experience. And then now being in the 2 weeks on, 2 weeks off, it's really nice because you kind of keep up with your skills. You're not out of clinical for too long where you almost, forget how to do certain things. It keeps you kind of up to date on everything too. And it's really nice to have that side by side with learning new things as well and being able to apply it pretty much right away. Which is a really, really cool thing with this program. Yeah, I don't really know what else, anything else to add, but I've really enjoyed being in this program, and I've made a lot of new friends from it, and very excited to finish and kind of start my career in this field.
Thanks, Abby. We might have Abby hold on the call if you can, and then at the end, if anyone has any questions for you, that might be great. Okay, thanks a lot, Abby. And now I believe Christy and Thomas are going to talk about some of the admissions details. So after all that information, how do you apply and how do you get in?
Yeah, thanks, Erin. Yeah, so now I'll just go into a bit of our entrance requirements and just general information about the admissions process for our program. So let's go to the next slide. So as I mentioned earlier, we have 16, we accept 16 each year, and our application window opens October 1st. So it's actually opened earlier this month, and it goes until April 30th. Now, when you look on our website, you will find that we actually have two kind of deadlines there. So we have two application deadlines. I can explain a little bit more about, but ultimately there is a date range that you can apply. And for the start date, the program does start every fall. So September 2023 will be when our next intake will start. Next slide. So about the application process, it is an online application. It's relatively straightforward. So just kind of bear with me as I kind of go through the details. So when the application cycle opens, which it is right now, you can log in and start reviewing kind of the online application. You kind of work through it at your own pace, completing and submitting all the requirements as necessary. And it doesn't actually go to the admissions department until you pay the application fee. So it is important to kind of check for the deadlines and make sure that you are submitting everything you need by that deadline. Now, when you actually apply, it doesn't actually affect in terms of, it's not like an order system. It's not a first come first serve type thing. So there really isn't, if I apply right now, I have a better chance than later. It's really just meeting those deadlines is the key thing. So just take a look at the deadlines and make sure you're meeting them. So what are some first things that you should look at? You should look at our entrance requirements to make sure that you are meeting them. And if you're not meeting them, this is an opportunity where you may need to kind of look at some upgrading options. So it's clearly laid on our website in terms of the specific courses and the grades that you need for them. So it is an opportunity to upgrade if necessary. Now, once you apply and you have all your documents ready, you scan them, you upload them as PDFs, and hearing sounds there. So
I got the sounds, don't worry about it.
Okay. So once you have all your documents ready, you upload them and scan them in. They get uploaded as PDFs. Now, one additional step is something called the Casper and mandatory questionnaire. So these are kind of two separate components. Casper is a third-party assessment that you have to kind of register for and complete by the deadline. There's specific dates for that. And there's also a mandatory questionnaire that you need to fill out and complete. And there's a bunch of questions that you need to answer and submit along with your application. Once you have all those documents in place and all the assessments, you essentially are ready to apply, and your application would be considered complete at that point. And the information I have right here, hopefully it's correct. And you have to double check, but I think the application fee for domestic students is $90 Canadian. I believe that's what the fee is for applying. Yeah, I think that covers that slide. And a lot of information there. So let's talk a bit about what our requirements are for the program. So because we are working in the clinical setting, we work with a lot of people. Proficiency with communication, so with the English language is important, and so you'll see that English 12 it has requirements there. You have math requirements, so our field does have a bit of kind of emphasis on a lot of technical math. So there's math requirements. And then you have the high school sciences. So you have the anatomy, physiology, chemistry, and physics. Those are all kind of part of our requirements. And as I stated on the previous slide, there's the Casper, and related to Casper, kind of all linked together is something called a snapshot assessment. They're both, again, third-party assessments that's required as part of our entrance requirements, and then the mandatory questionnaire. In terms of preferred preference that we have to applicants, we do have a preference. It's not a requirement. We do have a preference that the math, biology, and physics requirements are completed within the past 5 years. And it's mostly, this is more so that there is that recent kind of familiarity with these topics, because the program does have kind of heavy emphasis on those topics. It's not to say that if you are outside the 5-year limit that you won't get in or anything like that. It's really just for success purposes. We do recommend that have that, and we do look at that as a preference. Similarly, we find that some post-secondary education is an asset, really just helping with that familiarity with the workload at BCIT. Good grades, interest in the field, and another key thing that helps with the application is having relevant volunteer and work experience. So this can be volunteer experience that you do on your own time at, let's say, at a hospital, volunteering at a hospital, at clinics, or care homes. It could even be work experience, demonstrating that you have an ability to work with people, and those are kind of things that we look at with respect to your application. And let's go to the next slide. And I believe this is over to you, Chrissy, to talk a bit about some of the documents.
Sure, I can do that. I can talk about the documents. I think it's fairly simple. I think there was just some issues in the past with how do you deal with your transcripts and the documents. So they're trying to be a bit more flexible with that. So there's a couple of options for you. Option one, you can scan or take a picture of your transcript and you can upload, or you can download your digital transcript right from your either your school or your post-secondary institution, and you can upload. So what they're trying to get away from or move away from is mailing in the transcripts now. So we're trying to be digital. And just a note, if you are already a BCIT student, that you don't have to really worry about that, because they have access to all your grades. So one less step for you to do if you're already a BCIT student. Right. So the next step is talking about the admission process. So what happens after you submit finally finish this application, which, by the way, don't be intimidated. It's not crazy to do. We really are so excited about people that are passionate about nuclear medicine. So please don't feel intimidated by this process. We're just trying to share with you guys information about things you might have questions about, but don't feel that this is something that's like overwhelming. This seems like a lot. It really isn't. And it's very, very well laid out and easy to follow. So we really encourage you to, take your time. Don't feel pressured, but we would love to see your application. So what happens once you submit your complete application is admissions reviews it to make sure it is in fact complete. So they want to make sure all the components are there. Once all the components are there, they send it to us. So our team takes a look at all the applications. We take a look at how you did in your Casper and your snapshot, how much volunteering you had, what your academics have been like, what your related job experience, your questionnaire, and we compile all of that stuff to see who we think would be the best fit for our program. Which really, we just really want passionate people who we think can really take on this amount of information and apply it to the patient's to the patients that we want to help out. At the end of the day, that's what we're here for. So once we select our applicants, we let admissions know who we would like to offer a seat to, and admissions will then send you a letter and say, hey, you're in. You're coming, hang out with us for the next 2 years. And your requirement then at that point is just to put that in concrete and pay the commitment fee, which is $500, to say that, hey, yeah, you're coming in September. You know, I want to be there. So that's kind of what that process looks like. So next slide, which is where I got mixed up last time and forgot to do a nice introduction for Miss Abby, who has been such an amazing asset to our second year students. So I'm sorry about that. But the laddering opportunities. So we kind of talked a little bit about what can you do after you graduate and you're a nuclear medicine technologist. What if you want to stay in nuclear medicine? What if you want to get a different job? But what if you want to go back to school after you graduate our program? What does that look like? What opportunities are out there? So a few opportunities that are worthwhile to mention are other imaging modalities. So there's some post-diploma programs that are available, such as magnetic resonance imaging, or, as you might know, MRI, as well as advanced certificate and Bachelor of Health Science, as well as Bachelor of Health Sciences, which is a really great program. There's also a Health Leadership Advanced Certificate and a Bachelor of Technology in Technology Management. So most of these are at BCIT, but there's some at Thompson Rivers as well. So there's lots of opportunities where you can take your diploma and you can put it towards some further education. If you're, say, young and coming right out of high school and you're like, well, I'm going to do 2 years, but maybe I want to throw a little bit more time into my education, you have that time. Well, nuclear medicine is good because you can push that into another type of education to follow. So yeah, I think you're up there, Erin.
Yes, this is my part. Okay, so what happens after you get accepted into the program? BCIT is really keen on supporting all of our students, and we want to make sure there are lots of supports in place for our students to help you have a good experience at BCIT, not only in your education, but in your rest of your life as well. So some of the supports we offer that I wanted to highlight today, one is our Indigenous services. So they offer support to students who identify as Indigenous. They have a gathering place on campus, the Burnaby campus. They have information about Indigenous supports and funding, so they're a great resource. We also have student financial aid and awards, where you find out about all the different bursaries available, different scholarships you can apply for, different financial aid opportunities there. Third, we have accessibility services. So this department is for any student who might have either a permanent or a temporary disability that might require some accommodations while studying at BCIT. So if you believe you would need their services, you can contact them directly and see what's available for your personal situation. Student health services is really great. I love highlighting this one. We have what amounts to like a full service medical clinic on campus in Burnaby. And if you don't have a GP locally, or you can't get into your GP, I know it's sometimes a bit hard to get appointments with them nowadays, and a lot of us don't have them anymore. This is a great resource. You can make an appointment to see a doctor right on campus in between classes, before or after class, whatever works for you. Just down the hall from Student Health Services, we also have our counseling and student development offices. So we do offer counseling for all our students, the mental health supports there. And of course, can't forget our physical selves, recreation services. We have a full service gym on campus. We have cardio and weights. We have intramural sports, and we have a number of fitness classes that Christy and Thomas and I used to go together to back when we had time before the pandemic. He made us all kind of upheaval in our lives. So those are some supports to check out. Program advising. So if you have any questions after this presentation about your personal application, so I have this particular course, does it match up with this? Do I meet the prerequisite for this? You will want to connect with program advising. Now their hours that are listed here do change, so I urge you to check their website, bcit.ca/advising. They have telephone advising, drop-in advising. They have both in-person and Zoom options for drop-in. And they have email that you can email them directly. But I have to say that if you need an answer very quickly, email is not the best way to go. I love email. I love being able to shoot off an email somewhere. But if you need a really quick response, choose one of the other options. And we do have one of our program advisors, I believe, still on the call today, Janice. So if we have questions when we're done here, Janice will be able to answer a lot of those for us about admissions. So now we have come to the question and answer period. And so far, I don't see any questions at all in the chat. So since we are a small group tonight, I wonder if anyone has any questions. You can either type it into the chat, or since we're small, you could just unmute yourself and ask us a question directly too, whatever works for you. So does anybody have any questions that we didn't answer during our presentation? I know we did throw a lot of information at you very quickly. Christy, do you have a question?
I don't have a question, but I thought that maybe I could throw out one more thing, and that is something that we're kind of bringing back forward now that the pandemic is done. And we actually today had a student for a day. So this is a pretty cool program. You can apply to come and spend the day in our program, see what we're all about, see kind of what hands-on experiences our students are being involved with, what kind of labs, what does the day in the life of a nuclear medicine student look like, classes, first year, second year, and we'll toss you in a little bit here, a little bit there. So you can come spend a few hours with us and just see a little bit more about what nuclear medicine is, maybe what other students feel about the program, and you know, if you just want to see what it's like, we're totally open to hosting you for the day. So just reach out to us about that.
Does anybody else have any questions? If not, I'm just going to highlight the 2 email addresses on our screen. In addition to contacting program advising, you can definitely reach out to Christy or Thomas directly. Oh, Samantha, asking about the Casper test. Can we say a bit more about what exactly the Casper test is and how it's weighted too in the application process?
Yeah, so I'll kind of give it a first crack, and Chrissy, you might want to add to it after. But so the Casper test is again a third-party assessment, and what they assess for are personality traits, and you could think of it as interview style questions that they would ask that wouldn't be. It's not going to be centered on about nuclear medicine or anything like that. It's really some key personality traits, that characteristics that it's looking at. How it's weighted and how it's calculated is that Casper, the third-party company Casper, they will send your results. What they do is they compare you to everyone else that took the assessment, and they provide kind of a statistical analysis and give you a score out of it. And we get the scores, and so we don't get to see kind of your responses or anything. We see the score. So that's what we look at with respect to the score. Now, I believe, and I don't want to put you on the spot there, Abby, but I believe you took Casper before, so I'm not sure if you want to maybe speak a little bit about your experience with Casper.
Yeah, I remember being very nervous about the Casper test. But yeah, it's kind of like what Tom's was saying, like it's kind of small little interview question type things. Like they give you different scenarios. It could be a video that they play, or just like a text kind of thing of information. They'll give you a certain amount of time to think about your response. And then you have, I can't remember how long you have for each response, but you're also timed on your response as well. There were times that I wasn't able to finish my response in the time. So I know, like, talking to a lot of people afterwards, it is a bit stressful, but overall it's not too bad. They kind of tell you what to expect beforehand, and a lot of other programs use this as well. So there's a lot of information online about it and kind of other students' experiences with it as well, that I kind of looked up before as well. You can kind of see a lot of people do this. But yeah, it's not too bad. It's kind of just like a mini interview type thing.
Am I right when I say that there's some, like, when you sign up for Casper, or you create an account or whatever, there is like some mock questions or little mini interviews that you can kind of practice and get a feel for what it might be like? That might be like some anxiety. for sure. But as far as weight goes, we do consider it, but it's not the most heavy weighted thing in our application, because we do understand that, you know, sometimes these things are dependent on how you feel that day, or you know, how quick-witted you felt, or how, you know, how tired you are, or, you know, that sort of thing. So we definitely take it into consideration, but it's not like the most heavily weighted thing on our application. Yeah.
Thank you. Any other questions before we stop there? Okay, I just wanted to remind everybody that you will be receiving a copy of this slide deck that we had tonight and a copy of the Zoom recording. And to please reach out to us afterwards if you think of other questions that you weren't able to ask tonight or we weren't able to answer. Really appreciate, again, you taking the time out of your schedules to come meet with us online tonight. Thank you.